All right, all right. Good afternoon, everyone. Hopefully you enjoyed the music coming in. First and foremost, happy Women's History Month. I'm so glad you guys could be with us here today. Before I even get into intros, I need everybody to light up the chat with a word that you feel symbolizes woman empowerment. Let's let these ladies know how much they mean, how much we support them, give them their flowers, give yourself your flowers. Let's be present in this moment, because if 2020 taught us anything, every moment counts. So please just light up the chat. I see strength, I see resilience, empowered, courage. Yes, keep it coming strong, fearless. This is awesome. Keep it coming. Love it, love it, love it. All right, so in no particular order, we have Pamela Abner, President and Chief Diversity Operations Officer for the Mount Sinai Hospital Group's Office for Diversity and Inclusion. Patty Cortas, Executive Director and Associate CMIO for the Digital Technology Partners. Alicia Gresham, Senior Vice President and Chief Operations Officer for Network Practices. And we have Dr. Deborah Dean, Medical Director, Emergency Department, Mount Sinai, Brooklyn, Assistant Professor of Emergency Medicine, Icahn School of Medicine at Mount Sinai, Vice Chair for EM Quality, Safety, and Patient Experience. Thank you all for being here today. I know you are all very busy, so I really look forward to talking to you all today. So first off, we're going to get right into it. The theme of our talk today is our seat at the table. This is really specially symbolizing Shirley Chisholm, and this was the basis of what she really believed as unbossed and unbothered. So when you hear the phrase seat at the table, and I'm going to start with you, Alicia, how does that resonate with you?
Thank you, Sean. And I just want to say I'm excited to be here with such amazing women and participating in this panel. When I think about what it means to talk about a seat at the table, it means to me that that person is an active participant in being able to make influential and powerful decisions that impact strategy. And that could be financial strategy, operational strategy, system strategy, whatever that looks like for that particular organization. But it means that the power, the influence, and the decision-making capability is embedded in that person being at the table.
Thank you, Alicia. How about you, Dr. Dean?
So, for me, I think having a seat at the table is a win, but it's not the total win. I think, there's a picture in my office. I mentioned this at a previous session where there's 5 generations, and included, I'm sitting next to my great-great-grandmother who was born a slave. So when you look at the past, we've come a long way, and to be able to be here on this panel, first of all, thank you for inviting me and allowing me to be here. To have a seat at the table is definitely a win when you look from that perspective, but we have so much more to do, right? The ultimate win is the change that can happen as a result of an individual having a seat at the table. And so, like Alicia mentioned, the individual at the table has to use their voice, right? And you have to really speak up about the issues that you see, and make sure that your presence is known and felt to have the greatest impact.
Thank you, Dr. Dean. How about you, Pam?
Hey, thank you, Sean, and thank you for inviting me to join this panel. I'm pleased to be here today. So I'm going to answer it in a couple of different ways. So from one perspective is like, what are we at the table, right? So do we have that seat? And I think that it's incumbent upon us as an organization, as we look at different venues, that individuals should say who's missing from this room, right? Who's not at the table. So if you're in a space, and I know I have done this myself in the past, if you see that someone needs to be there, their voice isn't being heard, their perspectives aren't being taken into consideration, we need to get those people into the room, right? So this is an action that we all should embrace and think about who really needs to be at the table. And then, going back to what Dr. Dean touched upon, And then when you do get that seat, and so for individuals with whom I have conversations, women who I mentor, I say, if you're in the room, then you have to use your voice and your power, right? I consider that being in the room, we all have power, different levels of power, but we have to use our power and use our voice, right? Don't come into the room and then not express yourself and your perspectives, right? It's really, the onus is on us to show up and get our ideas out there and our perspectives, so that as decisions are made, what's going on in our communities and our organizations, that has to be upon us to make that happen.
Using your power and your voice. Excellent. And how about you, Patty?
Thank you, Sean, and thank you for the questions, and thank you for inviting me. I'm very humbled to be among this group. I have a mentor who used to say, if you're not at the table, you're on the menu. Now, oh my God, what does that mean, right? You can take it in so many different ways, and it's probably true most of the time. But the other thing is, whose table, right? Which table? Can you make your own table? I mean, when I have meetings with Alicia or Dr. Dean or Pam, that's the table right there. The making decisions or helping making decisions or solving problems. It's not always others people's tables. So it's a little bit of an awareness of, you don't have to really necessarily be, the CEO of something to be at that table, because sometimes CEOs are not even doing the day-to-day business. I mean, it's what do you want to accomplish? So, and the table can change every day. So we can go on with the table thing. So we'll put the table aside.
It's okay. We got some time to talk about it. All great answers, and I hope everybody is just taking these gems and really letting them soak in. I know I am. So we know that the table has many images and it's a destination, but it's really about the journey. And now we know your journey to the seat at the table. There were some clear disadvantages in healthcare, whether you're employed in the healthcare industry or receiving healthcare services, disparity in pay, not to mention some of the disparities in science. Describe a moment where you had to rise above those barriers, or even if those barriers really made you second guess your career path. And I'm going to start with you, Dr. Dean.
Well, I think, first, I'm very humbled to be here also, because I think I do have a seat at the table, but I'm not quite sure when that happened. I think along the way, you have to be passionate about what you're working on, and be committed to it. And not just that, because you can't just work and just have blinders on, but you have to connect with other people, make sure that your mentors, that you have mentors, and that they see your work, they see what your potential is, and that you can shine. And so, one of the times when I guess I first realized that I might have a seat at the table was when I was working on sepsis. And I was actually up for a position and I didn't get that position. I was really disappointed, but I was offered a different position, which ended up being an even better one. And I think that's a take home too, because sometimes you think that your opportunity is one thing, and it might turn up being not that, but something even better. But I worked to improve the sepsis protocol for Mount Sinai, Queens. I ended up being the lead, the hospital lead for that. And I ended up going to Mount Sinai and working with leadership at the mothership to improve sepsis care at Mount Sinai, Queens. And so being the voice of the emergency department, but also, the ICU and nursing for that small community hospital was amazing. And I found myself speaking up literally at a table. But Patty, your point is true. It doesn't have to be a table. But that's when I realized, yeah, my role here is really important, and I have to, address the issues that need to be voiced to make sure that we are able to deliver the care that's going to ultimately improve the care to the communities we serve.
Thank you, Dr. Dean. How about you, Pam?
So, when I think about barriers and opportunities, I think back to something that happened to me when I was very young and how my mother kind of raised us in terms of having our self-confidence. So in 6th grade, get my report card, and I think I got like a D or a C in something around self-control or something, right? Might not surprise too many people. So when my mother came in to the school for the conference, the teacher said, "Oh, she has too much confidence," right? This is what my 6th grade teacher told my mother. "And she thinks too highly of herself," right? Again, 6th grade. So my mother said, "No, she doesn't. This is how I raise my children. She should have that confidence." So my mother taught me at that point that not to allow anyone to make me feel as though I'm not confident and I can't be what I want to be. Because all my other grades were good, but this crazy grade, my mother said, "No, this is how I raise my children." So for me, the barriers that I faced, like the others on this panel and those in the audience know very well, women, people of color that we face, I looked at it more of, that's their issue, not my issue. I'm going to do what I need to do. And sorry, I'm in the room, right? If I'm invited to a room, I'm in the space. I walked into meetings early on in my career when I was an administrative resident back in the day at St. Luke's, when I was St. Luke's Roosevelt. And I remember a physician, it was a search committee for, a senior level practitioner. And I walked in, there was a white male in the room. As soon as I walked in, he got up and said, "Oh, I must be in the wrong room," right? Just because I walked in. So I looked at him and I said, "Nope, we're both supposed to be in this room." And I was in my 20s, right? But that's that same confidence my mother gave me. And so that's what I take forward. So if you're in the room and you're supposed to show up like you belong in the room, right? Don't let anyone make you feel as though you don't. And I know so many people who've spoken to me privately who say, "Well, I can't say anything because I'm here." And I always, I mentor them, guide them and say, "No, you really should speak up, right? Say what you feel." And we have to get to that. So, again, early messaging, I think for women, those of us, many of us who mentor, support, interact with young women, give them those same messages. Absolutely. Have your confidence. Don't let anyone tell you you're overly confident when you're in 6th grade, right? That shouldn't be happening, right? So we need to just kind of build that strength. So that's my story and that's my approach. And that's how I've led my life, that if I want to be somewhere, I'll go there. I don't care if I'm the only person of color in the room. I'm going to sit there and be as comfortable as everyone else in the room.
Thank you so much, Pam. As you can see the chat, they're loving that. Who are you to tell me I have too much confidence? I belong here. I'm supposed to come in with that type of bravado. So thank you. I'm going to go to Patty next.
Thank you for sharing that, Pam. I had a little bit of the opposite where, I came into this country when I was 8 with my mom and, had to translate for her, still do to this day. That's a different story. But, growing up, being kind of like the leader, without necessarily having the tools, when you're that young to take on a lot of that responsibility, creates a little bit of a different confidence. I didn't have it instilled in me by my mom. It was the opposite. And, I think that we all do different things with that. Some people, can go in different directions. I don't want this responsibility. It's too much, and for some of us, you kind of take it on because you have to. And, just continuing throughout my life in high school, I did my high school internship at Mount Sinai. I think I've mentioned that before. I go back a long time with Mount Sinai, but that needing to kind of help others, including my mom, and then of course, my younger brothers and sisters who I helped raise, barriers left and right, challenges left and right, always. But, believing in yourself when you kind of take these things on, it just continues to enforce And then of course, you always look for feedback, right? And back to the table, right? Sometimes you're not getting the feedback that, you should be getting, or you think you should be getting, because it's not always the things that you've done, it is that first appearance, whether it's a last name, whether it's an accent, whether it's just a background, whether it's, class or whatever that means, you're going to be judged no matter what. It's not easy, but you have to kind of dig deep into, okay, well, who am I? What am I bringing? And sometimes just kind of looking around, oh, I'm bringing something that, others may not have, or they may not even be aware that they have, that I have, that I can bring and then bring out in others. And that there's a power in that as well. So that's all I have to say about that.
Thank you so much, Patty. And now what do you have to say, Alicia?
So, my experience is interesting in that I thought I had a seat at the table in a previous organization where, I was included in meetings. I was part of a team that I thought, valued my input and my contributions. But I realized that, when we had a new team member added, it was part of our leadership team at a previous organization, a new team member came in, and she and I worked closely together. And she actually shared with me after being there for a couple of months that people on the leadership team that I thought, we were all working together and that my contributions were valued. She shared with me that there were people on that team who were actively working against me, right? And who said, don't do this with Alicia. Don't put Alicia on your project team. Don't pull her in for this, or it's not going to succeed. Because, there was, I had used my voice, right? And there were people on the team who did not like that. And so rather than address that with me or be open to that feedback and discussion, they pretended to listen and then actively worked against it. And so it was very eye-opening to me in terms of how do I even handle that, manage that? We both subsequently left the organization because it was not an environment where I felt I could be successful, or that I was getting transparency and honesty in terms of my value and contributions. And so, circling back to Pam's comment about confidence and Patty's comments about confidence, you really have to be strong in terms of your own value, your own contributions, because it's not always easy. And as Dr. Dean says, even sometimes when you're at the table, what is the decision, and what are you really able to contribute, right? And so that was really eye-opening for me in terms of my experience with sort of being at the table.
Thank you so much for that. That type of abuse of power, I mean, when we talk about retention and really keeping people who offer something to an organization, I think that's something that really resonates with a lot of people as I'm looking at the chat. And then I loved what, Lucia said about, it's not just about, the table, it's about being respected and being heard. I'll go to any organization where they hear me versus just having some blind seat at the table where I really have no power. So thank you so much.
Exactly.
Yeah. All right, so all of you have already alluded to my next question, right? So I feel like you're in my head. So mentorship is such a huge part of supporting, nurturing, and empowering the next generation of leaders. What advice would you give to someone who is currently a mentor or mentee, or is looking to get into a mentorship program and is looking to create a path to this seat at the table or to have their voice heard? And I'm going to start with you, Pam.
Thank you, Sean. A lot of things going through my head, but and it also depends on who they're mentoring, but just generally, I think that from the mentor perspective, and I know that we have many wonderful mentors in the organization, many are on this call and as part of this panel, that's probably one of the most important things we can do within an organization. So if we want to think about the Mount Sinai Health System just itself, that there's so many opportunities for others to advance and grow and learn, and that, again, it's in terms of our ability to lead and help shape the future, that it's something that should just be happening all the time, whether it's formal, informal, or otherwise. And I also believe that just having those connections allow people who may not thought they had a voice or lack confidence, or no one's ever given them that messaging, that it's important to share how we arrived at whatever position it may be in the organization. Doesn't mean we have to be the president of something, but just whatever it is, if you're a supervisor, whatever you're leading or doing, to share. And then for others, in terms of the mentees, again, I just have to say this too, because this is just another pivotal moment in my career and life, and it just goes along with the story. So when I was in graduate school, I remember my professor, who was my professor of health administration, I think it was called. She at the time was the chief operating officer for St. Luke's Hospital, as it was then, back in the day, aging myself. And in our class, she said one day, if you want to be anything in New York and healthcare, you have to have a mentor. So again, I didn't really know what any of that meant. I'm like, I don't know what that means. What's a mentor? So I remember, I guess it's that confidence my mother always instilled in me. And this was a woman who was very imposing, right? COO, you're 20 something years old. So I remember just getting up after class and walking over to her and saying, I don't have a mentor. Would you be my mentor? And it just happened like organic. I didn't think about it. I just got up and said, well, I have to have that. And she said, yes. And then because of that, that really changed my entire life and career, because she brought me into the hospital. She allowed me to do different things. I had an internship. It just kind of kept going from there. So I think that, and she was someone who I admired, like her style when I watched her teach and the stories that she told. So for anyone who doesn't have a mentor, I think that you should seek someone out. And some of the general guidance around that is, if there's someone that you admire in the organization that you see and you say, wow, how did they get there? Or wow, I'd really like to be like them. Reach out to them. It doesn't have to be a mentor program that's run through any particular thing. Just reach out, talk to them, have those conversations, because there are many different levels and ways to interact and mentor. And that's how you learn. I would not be sitting here today if she hadn't made that comment and I didn't get up, I would not be sitting here today.
Thank you so much, Pam. I'm going to go over to Alicia.
I think the mentor-mentee relationship and both sides, being on both sides of that is important, right? Once we get to a position where we can mentor people and bring them along with us, right? That's also part of our role as we move through the organization, is bringing others along with us. That's important, and really finding people's individual passion or ability to contribute and finding a spot for that. Or if they're not sure what that is in the moment, helping to give them access to different parts of the organization or different experiences that help them hone in on who they are and what they want. And from a mentee perspective, I really look for people who, whose style and leadership I admire, and where I feel there are opportunities for me to learn from them and contribute to them also, right? Because even as a mentee, we want that to be a reciprocal relationship. I think the other important role beyond a mentor is a sponsor, right? We also want to make sure that we identify sponsors in the organization or outside the organization who can help us, open doors or get access to rooms and meetings or people that we may not originally in our current roles have access to. So I think it's equally as important to find a sponsor or sponsors as it is to be a mentor or to have a mentor.
Yeah, I love what you said about the sponsor, because it's great to have the mentorship, but then what's the next step after you've gone through all of this coaching and you've advanced your skill set? Having a pipeline directly into something as far as leadership, I think is so important. Thank you so much. Next, I'm going to go over to Patty.
Thank you, Sean. Sponsors, I'm just going to take that for a minute. sometimes can be mentors, not always, but you have to start with kind of a mentor. You have to start with somebody who knows you, as a mentee. I've had a lot of mentors in my career. Some of them didn't even know that they were my mentors, kept that a secret. I just kept bothering them, and, to Pam's point, like you find someone that can teach you something, or maybe they're not even aware that they can teach you something, and you reach out to them. As mentees, and it's one of the reasons why we put some effort as a system and as individuals in putting together mentorship programs, with a structure, because sometimes, not all of us have that ability or confidence, or whatever you want to call it, to actually ask somebody to be their mentor. They need a little push, and that's why the mentorship programs work in both ways. There is no such thing as a bad mentee. There is no such thing as a bad mentor. Maybe there's outliers, I'm sure, but everyone's got something to teach, whether you think of, you do or you don't, whether it's a skill, going through life. I mean, we've all mentored somebody else. Think about high school. Maybe you're a senior and, some sophomore or junior was hanging on to you or something. Like, there's a reason for that, so I think it's extremely important. And, we talk about it a lot in different circles. Sometimes, if you can, and you have the ability to reach out to someone that you can see may need a little bit of a lift or a push, and it doesn't even matter, again, titles, irrelevant. It's wherever you are that, we meet people every day, and, they may be a little bit of afraid or feel insecure to ask, but you can, so that would be, that's all I have to say about that. No, I'm just kidding.
No, I love the line, titles mean little. I remember back in 2015, I read the book, The Leader Without a Title by Robin Sharma, and that completely changed my outlook on how I approached what I did. And I suggest any of you who are readers out there, check out that book. It will teach you a lot. Thank you, Patty. We're going to finish off with Dr. Dean.
Yeah, so first of all, there's been, so much incredible information from both from Pam, Alicia, and Patty. So thank you for all of that, because I'm learning just as I'm listening. I think, so much has happened in the last couple of years. So, with COVID and Black Lives Matter, there's been so much happening with January 6th. We now have Ketanji Brown Jackson as the first nominee, African-American nominee for the Supreme Court. Jaw-dropping events. And I think we all could use mentors. Even the mentors could use mentors. We have to continue to talk with each other, and find new ways of approaching the challenges of today. Today is not like before 2020. And so, especially, as we want to continue with, innovating and transforming Mount Sinai, being the best at whatever it is that we do, we have to continue to, connect with others, and it's through mentors and sponsors. So important. And the one thing I would say about mentees is, and what I try to encourage mentees to do is to find their passion, because that gives you that drive and almost, confidence is always important, but when you're passionate about something, nothing else matters as much, right? So you find that passion and you keep moving forward, and you match that with, I got this from Carla Harris, who has written some incredible books for women on how to be successful, but you marry that with the values of your institution, and there you have it, right? So you have a passion and you apply what it is you're working on with the values of the institution to add that value. I think that was you, Patty, that talked about adding value, and that brings you forward. And hopefully once that light shines on you, there you have it. And with the mentors and sponsors, that's the light. Once they're the ones that bring you to the light. So it's such an important point, and this is the time that we can really, you know, make sure that all of us are benefiting from mentorship in particular, and of course sponsorship when we can.
Thank you so much, Dr. Dean. I really feel the line about passion, right? Passion is that one trait that gets you from what you have time for versus what you make time for. And I think as we all navigate leadership, we're always trying to get people to understand time management, prioritization, understanding what's yours and what's not yours, and then learning how to navigate all of that. So thank you so much. This is a great conversation. Everything you guys are saying are leading right into my next question. So this is just really awesome. So when we look to the road for such names like Kamala Harris, Stacey Abrams, Ketanji B. Jackson, and we look within our own institution, we look at the Dr. Richardsons, the Kristen Myers, even you, Pam, Patty, and Alicia, and Dr. Dean, I think of our current roadmap for action. Right, we have 11 strategies where we're looking to really make an impact here at Sinai, and how we look and how we can be in line with the communities that we serve. What strategies do you think need to either be maintained or created to sustain the continuity of diverse leadership like we've seen happen over the last couple of years within Sinai? And I'm going to start with Patty.
Oh boy. I'm going to go back into my clinical career as a PA. I've had the opportunity to work in amazing places, serving a lot of different patients. I worked in homeless shelters. I ran clinics there. I worked at Montefiore and health in hospitals, and of course here in Mount Sinai. And, you know, as I say that, I've been very fortunate. I've also been, you know, unfortunately, I have to see the amount of disparities. Blatant sometimes, and sometimes not so blatant. You know, whether you want to call it the, you know, this clinic or that clinic that serves different kinds of patients, versus on the inpatient side, you have the resident list, the PA list, the faculty, whatever you want to call it. You know, it's been around for my entire career, it's more than 20 years, and it's still there. One of the strategies that we have is to, you know, blow that open. But it's not easy, right? I mean, we need to, you know, not just Mount Sinai, but, you know, everywhere. But it's hard, right? Because there's so many incentives. As much as we as individuals want to do that, and we know that that's the right thing, you know, it takes all of us, from legislation to insurance to, I mean, you name it. That's one of the things that, you know, I think we're trying to tackle in different ways. You know, for example, even through technology, you know, we're trying to create more equity. You know, we're trying to make sure that, for example, our patients, even outside of Mount Sinai, have access to Mount Sinai, right? You know, again, a little bit of technology, but a little bit of, you know, pushing forward and changing that narrative. It's not overnight, which frustrates all of us, I think. But, you know, to answer your question, I think that's the strategy that we really need to work on.
Thank you, Patty. Dr. Dean, we can go over to you.
Thank you. So I agree with Patty. You know, when I look at working in the emergency department, I mean, access to care is, you know, front and center, of course. But so in my role as medical director, you know, everything from my staffing choices to, you know, what I put on my agenda at my clinical staff meetings. You know, we're working, I know, in emergency medicine to make sure, well, the health system, to make sure that the demographic data that we have will help to bring awareness and highlight those disparities. But we need to get we want our data to really accurately reflect and really drill down as deep as possible what exactly is happening with the patients that we see, so we can continue to cater, you know, and tailor that care as as well as we can. And so, for what I do, in everything that I do, bringing awareness, and I'm really thankful to Pam and the entire team for creating our roadmap, so we can continue to use that as our resource and continue to build. And yes, that's going to keep us on track. And that, I think that's the key, is just continue to follow that roadmap, and in everything that we do apply, even in small things like the topics I'm going to talk about, to my patients when I go to the bedside, how I address them, how I speak to them, how I include information that's relevant to them that could be potentially life-saving to them. Those are the kinds of things that I think are really important.
Thank you so much, Dr. Dean. And if any of you wanted to know about some of those topics, you can go over to the Roadmap for Action website, and we have bulletins that come out every Thursday. I couldn't help but do the plug. I had to. So next up, Alicia.
We actually take the bulletins that come out on Thursday, and we talk about them and read them on the huddle, our leadership huddle, on Friday morning. So, I think one of the ways we have to, as leaders, is cascade this information outward, right? So that we make sure that, it's not just a few people talking about it, or it's on a website and we don't really make it actionable. I think the other couple of things that I would mention is, on the non-clinical side, I think the supplier diversity is a piece. How do we start to make sure that small, women-owned and Black-owned or underrepresented minority-owned organizations and small companies start to get a piece of the pie, so to speak, right? And how do we help support them in a way that they understand how to work with a large organization, right? And it's not enough to, say, oh, we have X percentage of companies that we work with that have minority ownership. No, it's really making those real, right? And understanding how are we using them? What are we purchasing from them? How do we give them the support to be able to grow their business and, continue to contribute? Because that really is not just helping us, right? That's helping to them then build, an entrepreneur, to hire people, to contribute to that local community. And so I think those are important things we don't always think of. I know we're thinking of it, it's part of our roadmap, but I don't think everybody always thinks about those kinds of decisions and where you can start to diversify your choices. I think the other thing that's critical is that as a leadership organization, I think we need to give more access to our incoming and developing leaders. And we have a wonderful series, the fellowship program and the mentorship programs and other programs. But I've seen in other organizations where, especially non-healthcare organizations, where they literally rotate people through different departments and parts of the organization so that that person has a better understanding of all the components of leadership and leading a large organization, and has sort of that broader viewpoint. And it also gives access to other leaders to that person, right? So they can see what they contribute, what their value is, how they can help move the organization on and bring diverse ideas to the table. So I think those are a few of the things that I focus on, and I think we should continue to focus on across the organization.
All great points, and they are loving it in the chat. Pam, you're my closer. I know you have a lot to say on this, so bring us home.
Thank you, Sean. So as I think about our roadmap for action to address racism, I think it's phenomenal that Mount Sinai Health System has put this in place, right? And from the most senior leaders in the organization all the way through, this is something that we're committed to. And so to answer your question about how do we keep it there, I think, and how does the organization really demonstrate that commitment? It's a matter of resources. So, that expression, put your money where your mouth is. There is a number, and Alicia referred somewhat to resources as well, right? How do we spend our money? What are we spending it on, right? And that ongoing commitment to funding those programs, things, community, whatever it may be, that align with our strategies for the roadmap, I think is what's going to be needed long-term, and then we'll stay on course. But the minute that we start to back away from that, then we'll start to lose that traction. And then alongside with that, the financial commitment, it's kind of combining two things, the accountability, right? So again, with it, like anything else within an organization and any other huge endeavor and initiative, and this is, system-wide, all aspects of the organization, nobody gets away without being able to participate or kind of come forward with their commitment to the roadmap. It's that accountability. And that's, again, at all levels, but we start with leadership, making sure, and things are being done now that people may not be aware of, but in terms of job descriptions and what language that we're using as we bring new leaders in, and using words like anti-racism and supporting teams and developing diverse teams, and being able to have managing difficult conversations around topics. All that's now being part of what it takes to be a leader at Mount Sinai Health System. And we're starting to embed that language and make that an expectation for all. So, and then just lastly, I would say, and I think Patty said this, but it had to be Patty because it's data. And then using our resources that we have. So once we have those resources, we have the leadership commitment, then we can look at our information and our data in so many different ways to see where we're going. So I think that's kind of a trifecta of things, but if that stays and we have the commitment there, using all of our resources, IT and others, that's how we stay on course with the roadmap.
Thank you so much, Pam. All great points. We're talking about access, resources, funding, collecting data, accurate data at that, and then being able to have conversations, brave conversations, but empowering our leaders to feel comfortable to have those conversations. I mean, it's just the perfect cocktail for a great conversation about diversity and improving things at Mount Sinai. You ladies are great. Thank you so much. So right now, I see some questions in the chat as far as the book. The book is called The Leader Without a Title. The Leader Without a Title. The author is Robin Sharma. So hopefully you guys all got that. Check it out. You can start to put your questions in the Q&A. I have to make this fun now. You guys know how I lead these things, right? So this morning I heard Will Packer, talking about producing the Oscars and it being hosted by a diverse group of women. You have Amy Schumer, Wanda Sykes, Regina Hall. So you all have different leadership styles, right? So if you had to pick a singer that embodied your leadership style, and I'm going to start with you, Alicia, who would that be?
I'm going to go with our intro song, Jill Scott.
Yes.
I feel like she brings a lot of heart and soul, right, to her music. I think I bring, a lot of authenticity and heart and soul to my leadership style. But, I think she's also super talented and brilliant. And I won't say I'm super talented and brilliant, but if you want to say it, I'll take it. So yeah, I think I would pick Jill Scott.
Okay, how about you, Patty?
I would have to pick, and this is going to sound a little weird, but Edie Gourmet. So I grew up listening to a lot of, what is really now old music, but I guess, even back then wasn't that recent. And I just fell in love with it. I love the fact that I didn't even know this. I thought she was Spanish the whole time. She was American and she sang in Spanish. Beautiful, beautiful songs with El Trio Los Panchos. And it's just, when I'm in a mood and I have to drive a couple of hours, that's the music, and it just resonates with me.
Thank you, Patty. How about you, Pam?
Well, there's so many, but definitely I would agree with Alicia on Jill Scott. But I also think that in terms of inspiration and kind of making her way through difficult times and not holding back, I have to go with Aretha Franklin. for bringing, and you know, at the time that her music, it was there, and it was so needed to help so many people with her strength. So I think I'm going to go with Aretha Franklin for so many reasons, right? And respect being a primary among them, right? Instilling that in us, that we have to have that respect, and that we all need that.
Definitely. Dr. Dean, who are you going with?
First of all, Sean, this is very hard. I just want and Pam, I just have to say RESPECT. I think that's spot on for you. You know, I don't know. The first thing that came to mind was Alicia Keys. First of all, I love her. But I think she's very smooth. I think she's got her eye on the issues, and like she tries to make her songs relevant and impactful. And she doesn't wear makeup all the time, and neither do I. I don't know.
No, that's
a tough one.
No, that's good. That's good. That's good. So I don't see any questions. I'm guessing I was that good. I asked all the questions. You guys answered everything. This has been really good. I just want to let the audience know you were just a part of a personal conversation. The only way I could lock all of these women down was to tell them it was a panel, but thank you so much. What I will say is, it is Women's History Month, and I really hope that everybody is taking care of themselves with everything that's going on in the world. I'm not going to get political here. I just hope that everybody is taking care of yourselves. If you need to take a moment for yourself, take a step back, please do that. But I really hope that you got something out of this, because I can tell you, I know at least Patty and Pam very closely. These have been my mentors for over the next couple of years, and I will be contacting Alicia and Dr. Dean from now on, because now they are my new mentors, and they are going to help me get better at being an ally. So I hope that everybody stays involved in this work. I'll leave it to you ladies to any last remarks to the crowd.
I just wanted to say what I said in the chat. Sean, I didn't know you had this other side to you. Like, seriously, you can do, I don't know, host a night talk show. I don't know. It's you're really good at this. So thank you for making it easy, because you know it's not always easy to talk about yourself, even if we pretend that it's just a conversation between us. You know, you want to share, and you want to share enough that you know it resonates, and you know it's helpful in some way, and it's always a little therapy too. So, but thank you for making it fun.
Yeah, thank you, Sean. I just want to say also, you did an amazing job. I feel really comfortable. It's very easy for me to talk, which is awesome. And just thank you for having me. You can call me anytime. We can chat. Any questions, anything.
You all heard her, right? Oh.
And just thank you for this opportunity to be here today. It's really, really appreciative.
Thank you. Thank you.
So Sean, I see that I see there is a question from Freddie, so I'm just going to, in the Q&A, so I'm just going to answer it. And I think you touched on it already. It's how do we take care of ourselves to keep going? So that is difficult, right? And there have been many days, and I'm, you know, as I look at my colleagues here, I know that we all have had difficult times. But what helps is getting together and talking about it, right? So I know Alicia and I, we've gone out to dinner and chatted, right? Mm-hmm. Patty and I, and you know, we have a group that gets together. You have to like find your people, as I say, and just sit down and talk. And when you start to let it out and you just have your group who you trust, you know, again, make your own table around that and just find people to talk about. Don't hold it all in, right? If you need to reach out to someone, reach out to someone. I would not have survived a lot of what I had to go through to get this work done if it weren't for the fact that I could pick up the phone or send a text and call many people in the organization at different levels. You know, and I don't want to call out a special name, but there's a particular person, you know, senior leader who I call upon regularly as like my therapist. And if he were on here, he would know who he is. So that's important. And again, Sean, outstanding. So I think any panel, anything we're doing, you're the host, because you are. And those trick questions, I just want the audience to know, we didn't know what he was going to ask us. others at the table. He didn't tell us about all these trick
Yeah,
questions.
there's always a secret to my mouth.
Yes,
Yeah.
but you're excellent. Thank you so much. Thank you for doing this.
Anytime.
Yes. And I will just add, again, yes, call me anytime. Happy to talk to you. And thank you for making this such a comfortable and welcoming environment. I think, these are always a little nerve-wracking, these panels, especially when we don't know the answer to the questions. So thank you for making it interesting and fun and educational for all of us. And I, really admire everyone, all the women here, and really consider them, mentors in many ways, because I learn from them all the time. And so I appreciate being able to work amongst people who always challenge me in positive ways and who I learn from on a regular basis. So I really appreciate the opportunity.
Thank you. It was great having you all. All right, so I'm sorry, guys. We have to go. We all have to get back to something that we have to do. But hopefully next time we can have these ladies here again and they can tell us all the great things that they're up to at that time. Thank you all for joining. Elizabeth, let's go back to the music. Let's send the people back in a good mood with Jill Scott. Let's please do that.